Okay, so first few scans are of the prep. So I just make sure it's good and dry. We're going right over on the prep, on the occlusal of the prep. Just press the foot pedal. We give you a preview window right there to see if you can see all the. You see the margins, and I want to make sure I can see the margins all the way around. I don't have any tissue on the margin, I have no bleeding on the margin, and that's a good scan. So I'm going to go ahead and say okay, hit the foot pedal, and now I'm going to do the lingual. Go around the lingual here. And if I move or the patient moves to a degree, it will tell me to retake the scan. Now I'm going to do the proximal surface of the adjacent tooth. I'm getting the axial wall there, basically, contact area. And now I'm going to get the rest of the teeth in that quadrant. So essentially, I would be done at that point because the assistant had already scanned the opposing, so I'd be done. But for the demo, I'm doing the whole thing. So I'm doing the upper now. See, I moved, so it says retake the scan.
I notice how you're looking in the mouth.
I'm not looking in the mouth because I can rest it on the teeth. So,
right. Yeah, you don't need
so I don't need to have it there. That moved, but because there's a rubber tip on it, I'm not worried about pinching them or anything. I'm just barely resting it on there, fulcruming on his jaw basically. And then how the models are articulated, you do two jaw relation scans. So I'm going to come from the buccal side here, and the patient bites all the way together. The nice thing about it is you can tell if the patient's occluding all the way together. So I'm looking down, I can see, okay, Tom, open for him just for a second, just a little bit. You say, okay, close all the way together, squeeze together, squeeze together. Then you can see, now you know you're getting an accurate bite. Because if you put bite registration material in there, you never know if they're opening slightly or moving their jaw side to side. And then I can see that they're moving, so I know.
So clean that way.
Yeah, and there's no material in between the teeth, so that the bite record is more accurate than injecting putty in there. And with the triple tray, you're not doing that, but if you're doing a full arch, you're having putty in there. So, and then you're going to get a preview quality image here, and this is the scan we just did. And so here's the prep. What I'm looking for is I can see the margins clearly all the way around. This shows me a color mapping of how much reduction I have. So you look at this. Clearance legend here, it tells you in this region right there, I've got about 1.3 to 1.5 millimeters of clearance in that spot. So, looking back, I may have been able to go back and adjust the opposing or adjust this tooth if I felt like I needed to. So that's the nice thing is, especially on the second molar, you think you've got enough reduction, and a lot of times you don't.
See it all there, not under the
yeah. So you can rotate your prep around, look at the bite. You can rotate it like this. You can flip it upside down, and there's your impression right there. That's what your impression is going to look like. That's what we're looking like. What we're seeing in an impression is that. So the beauty of this is it's like taking an impression and pouring it up in stone, and there you have it right there, without having the lab have to mess with it at all.
If you have to make the change on the existing one, then do you have to take the whole new scan, or do you just scan those?
Just scan that quadrant. Yeah.
Just the two.
You have to scan the quadrant because what happens when you scan is you get that prep in more than just the initial 3 scans. When I'm scanning this tooth here, I'm picking up part of that tooth in the scan. So if you only scan this, it wouldn't know what to do with those other scans. So you have to scan just that quadrant. Yeah, not the opposing. So whatever arch you made a change to, you have to go back and
So normally how many pictures do you have to take?
well, for a quadrant like this, standard quadrant, all the teeth are in the quadrant, single prep, I think it's 17 scans, I think. It might be 18 scans. So.
17 on like a second bicuspid and 21 if it's a first molar back.
Of course, the bigger the case, the more scans are going to be. And if you do a full upper and full lower, it's around 55 scans or something like
So you
that.
follow the instruction of the
Yeah, you just fly right through it. I mean, I'm just going, and I'm just resting, going boom, boom,
Even you
boom,
could
boom,
do it.
boom.
I'm drunk.
So